Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for joining us today. We're going to be chatting with Dr. Jamie Almendoz about non-surgical weight loss options. You'll be talking about healthy diets, causes of obesity, ways to treat it that don't involve surgery, as that is an option. Before we get started, I want to remind everybody to make sure that you ask your questions in the comments section on your Facebook feed, and please be sure to like and share our chat. This is a really great topic. We want to make sure that everybody is able to watch it, that needs to see it, and that we get some good traction here. So before we start, we also want to thank our team over at Clemens for sharing this, as well as the Department of Surgery. They've been really helpful promoting it. So, Dr. Almendoz, it's great to have you here.
Great.
Thanks for joining us.
Not at all. Thanks so much for inviting me today.
Yeah, so I guess we'll start out with, why do so many people struggle with obesity?
That's a really good and very complicated question. I think if you look at the numbers, obesity is a problem which is continually increasing. It's almost 40% of adults are struggling with obesity. Almost 2/3 of the population are overweight or obese, and 20% of young people are struggling with obesity too. And it's how do we start to address this problem? If you look at it, there have definitely been changes in our environment and how we interact with food. There's a never-ending supply, it seems, of food that's very rich in calories, very tasty, very well marketed towards us, that may sometimes confuse us as to whether this is an appropriate food for us or not, if it's going to give us more calories than we need, or what's hidden in certain things, or condiments or dressings or other fixings that we tend to add to foods in order to make it taste good, particularly if it's like a salad and we may not like it.
Right, everybody wants to add that cup of dressing, it seems like.
And then in our other environment, it's more difficult to walk anywhere. We have to drive somewhere. You can't go anywhere in Dallas without valet parking, right? We don't even have to park our own car.
That's
I think if you look at a lot of the activities we use in order to unwind or relax from our busy days or busy schedules, it involves us sitting down, streaming show after show that will automatically start and just grab us back in. And so I think our built environment and the way in which we interact with our environment really promotes us to gain weight, and it can be very difficult for us to take control of that unless we have a plan.
So one of the things I wanted to ask before we get too far along is, you mentioned a lot of it is environmental. What are some easy steps people could take to maybe start to get healthier?
In terms of healthy...
In terms of possibly start losing weight.
I think being mindful of what you're doing. I think a lot of times we tend to consume food when we're not hungry. We may consume more than we need. I think a lot of times we're very out of touch in terms of our cues for when to eat. It may be, it's noon and I have about a 15-minute window between phone calls or meetings or something. I need to eat now, otherwise this opportunity won't come up again. And we may eat if we're not hungry. We may eat because it's there in front of us at a meeting. There's a cookie here. I think I'm just going to grab this now. Exactly, and it's very difficult for us to know how much we're consuming, particularly if we're distracted, we're working through our lunch, we're doing emails. So being in that moment, deciding, is this the right thing for me? Do I need to consume all of this? And to make sure, I think I'm full now. I think I need to stop eating. And I think a lot of us may have lost touch with what that fullness feels like. Kind of the similar way that we may not know, am I really hungry right now? Or is this a situation which is saying, why don't you eat now? And it may be that kind of evening time after dinner where we're accustomed to watching the news or watching a show and eating at the same time, even though we may still be full from dinner. And I think knowing whether you're hungry or full, knowing what's in the food from a calorie perspective can help us to make decisions in that moment.
I think you have some really good points there, and I think kids are really good at saying when they're full and when they're not hungry. When they're hungry. But we have some questions that have come in, so I want to take a couple of these before we get back to that thought. The first one is from Lori. Lori asks, do weight loss medications really work? I mean, is that a viable option for some people?
So I think up until a few years ago, there weren't too many options when it came to weight loss medications. Most of them were relatives of amphetamines. And I think they were prescribed very easily by a lot of primary care and other doctors to help people suppress their appetite, and a lot of people had bad reactions to these medicines, and they've gotten a very bad reputation in the news. And since about 2012, there are about 5 FDA-approved weight loss medications on the market. But like tools, sometimes the tool is the right thing for the right job, and making sure that you match the right kind of medication to the patient, but making sure that it is being used as a tool to help facilitate them changing how they interact with their food environment, how much they're consuming, in order to help them lose weight. When we consume fewer calories than we need, that's when we start to mobilize the calories we have stored as fat. And I think that is really ultimately what helps us to lose weight along the way.
Good question, Lori. Thanks for bringing that up. We have one from Veronica. And I know as part of your clinical practice, you do work with patients who have had bariatric surgery. So for that, this comes from Veronica. She says, after weight loss surgery, how soon can you have skin removed? Is that something you could address?
Yeah, it is. And so typically patients will lose weight very rapidly over the first year to 18 months after they've had weight loss surgery, and then their weight loss tends to slow off. And so what we want to do is make sure that you are at your steady weight or your goal weight before you consider having your skin removed. What you don't want to do is for you to have a skin removal surgery and then for you to continue to lose weight, because cosmetically the results are not going to be what you want. On the same token, what you want to do is make sure that you are maintaining an appropriate body weight for you, so that you don't start to then gain weight after that surgery and then end up with the other side. And I think making sure that we have the right tools in place in order to help you achieve your goal for weight loss is the most important.
It's a good question, Veronica. So we've got one in from Mary. This has come up in groups that I'm part of. She asks, as we age, is it true that it becomes harder to lose weight?
I think there are a variety of factors that happen as we get older that really promote us to gain weight and then also have difficulty losing weight. As we get older, we become busier in our careers. We end up being less physically active in a structured way. We may have joint pains or other things that go along with that. Our eating habits may change. We may do a lot of social activities which may revolve around food. We may get entrenched into habits when it comes to eating and how we use food maybe to moderate stress and other emotions in our lives as well. Aside from that, as we get older and we're moving less, our muscle mass decreases, and muscle's the furnace in our body that burns the calories. And so if the furnace is not burning the calories as efficiently, we need fewer calories, but we may not change the amount we eat at the same time. And that tends then to mean that we're in a surplus of calories. We store those calories as fat, and that results in the weight gain. But that's aside from hormonal changes that happen as we get older, which may influence our metabolism and our muscle mass and some other things as well. So it's a very good question, but there's no easy answer to that.
If only there was. That'd make a lot of people happy. So great question, Mary. Thanks for asking. So here's one from Jay, and this one is another common one. It says, there are so many diets out there. Does it boil down to calories in versus calorie out?
You know, fundamentally, yes, but I wish it were as easy as that. And I think if we look at all the studies that have compared the kind of high carb versus low fat, and then the high protein versus low carb, and all these together, in a global sense, if we look at the results in aggregate, the best predictor is the one which restricts calories on a consistent basis that the patient's able to do. And so a lot of times patients will ask me, what's the best diet for me? And sometimes it boils down to the one that you're able to restrict your calories in a consistent way that you find appealing, and one that is sustainable. And I think that's sometimes the hardest thing. A lot of the diet plans out there which result in a lot of weight loss very quickly are sometimes unsustainable habits. And when we get into those, we may not have a clear plan of how we're going to maintain that weight loss. And I think that sometimes leads to the frustration that patients have once they've lost the weight when it comes back. And so we need to make sure that we work on the lifestyle plan in order to maintain that.
Gotcha. So when you say sustainable, does that mean for the rest of your life, or you have to maintain that caloric number?
And I think that's a very difficult or frustrating concept for a lot of my patients, and we tend to frame this as weight loss is not necessarily a destination, but it's a journey. And along the way, we're going to have to do a few side trips, and there are going to be things which distract us from our journey. And sometimes people see that as a lack of willpower or a lack of other things, but there are going to be other things in our life that are going to be more important than weight loss, and we need to accept that that is one of our goals, and we just need to work on it continually. And it can be frustrating, but that's part of it.
No, it can be. So this is really a different question along the same topic, and I want to remind everybody, so we can't answer specific questions about you, but we can answer them generally, and this is one of those, but it's a common one. It says, I've been going to the gym every day, but I haven't lost any weight. What am I doing wrong? Is there something else that I should be considering?
And I think that's a great question.
Good one, Jeff.
And particularly a lot of patients at this time of year, they may have gotten an activity tracker or monitor, or
Christmas.
They may be capitalizing on some promotions at a local gym where they've joined. I think weight loss, if we look at the majority of scientific studies that are well designed out there, really doesn't contribute too much to weight loss. And I think that's a very alien concept to a lot of people, particularly when they may say, well, you know what, I used to be able to eat what I wanted to, and I just worked out to compensate. But what we know is that, even if you were to increase your levels of exercise, you're not going to lose that much weight. It can augment some of the weight loss that comes with calorie restriction or dietary changes. But really what it does, it helps us to maintain our muscle mass when we restrict our calories so that we don't lose as much muscle. And remember, before we touched on the topic that muscle's the main furnace in the body that burns the calories. And one of the issues can be is if we're on a diet, for example, that's very low in protein, in order to maintain our daily functions, our body might burn up the muscles that we have in order to provide us with protein. And that means our metabolism slows down, and that means it's harder for us to lose weight, but also easier for us to regain the weight once we've lost it. And that can contribute to the yo-yoing that people see as part of their weight loss journey, but especially after weight loss surgery, when it may be more difficult to eat meats or get the right kind of protein into your diet.
Gotcha. So related to that, I've heard several people say that, they run so they can drink beer. I mean, or eat chocolate. One of the two, it seems to be in my circles. I mean, is that not the best idea?
I think when we try and transactionalize weight loss, sometimes we can get into trouble. And I think if we look at it in terms of, they're two different beasts, if you would. One is weight loss and exercise, and one's weight loss maintenance and exercise. And for people who want to maintain their current weight, exercise is a very useful tool for helping to moderate that. But when we are on a weight loss journey, we're actively restricting our calories. The number of calories that we burn, or that our activity monitor or the bike in the spin studio tells us we're burning, may not be accurate, because we're not a one-to-one conversion sheet. We don't we're not a balance sheet that people would think of, and a lot of patients may come into the office and they'll have a spreadsheet of the number of calories they've eaten and the number of calories their activity tracker says that they've burnt, and they're frustrated that it doesn't tally up to weight loss. And I think we need to look at it that we don't obey those laws of thermodynamics when we're trying to lose weight.
Good to know. Good points there. All right, we've got a lot of questions coming in. Really great questions. Keep them coming. We have one here from Jeannie, and I think this affects a lot of people. Jeannie, she asks, I have numerous health issues such as diabetes, kidneys issues. How will they affect weight loss?
I think they can affect weight loss in a few ways. I think it would be remiss of me not to mention that a lot of these things will be potentially improved by losing weight. But on the same token, there are a lot of medical conditions which can make it more difficult for us to lose weight. So a lot of times when we struggle with chronic kidney disease or kidney failure, we feel very tired. Our diets may be restricted because of dialysis or the treatments we're taking, and it can be hard to find the right kinds of foods or maintain the activity that we'd previously done to maintain our body weight. With regards to diabetes, there are diabetes medications that promote weight gain, but at the same time there are some newer diabetes medications that promote weight loss and can help us to take control of our weight and our appetite in a different way. So making sure that you talk with your primary care doctor or whoever manages your diabetes to make sure you're on the right combination of medications to help you reach your goals.
Okay. So this is an odd question, but it comes from Sean, and I want to make sure we point it out. And he's asking, are bananas okay to eat on a low-fat diet? It seems like yes, you can absolutely eat bananas on a low-fat diet.
So in terms of fat, there's not much fat in a banana, but it's something that we talk a lot with about our patients, that there can be carbohydrates and other things which may not be aligned with our goals, particularly if we're trying to moderate what we're doing from a dietary perspective. Most people feel the bananas are a very healthful food for them, but they contain as much carbohydrate or starch or sugar as 2 slices of bread, but actually more sugar. And so making sure that we moderate what we're doing and that we know what's in something, even if we just believe it to be healthful because it's a fruit.
Right, okay. I know bananas are popular in my house. So we've got another one. This one is from Julie, and she asked, and you touched a little bit on this earlier, but she's asking for your thoughts on low carb dieting. It seems like it's kind of a mixed bag.
I think low carb dieting is a very popular way of losing diets, and there are different kind of grades of what a low carb diet constitutes. If you look at the average American diet, we're getting about 60% of our energy from starches or sugars. A lot of that has come from the low fat dieting mindset that many of us had in the 80s and 90s because we were worried that fat was going to give us heart disease.
Right.
And so what we did was we then switched from that to more of a higher carbohydrate diet. But there are a lot of experts there who believe that the change or the shift in consuming higher carbohydrates has really fueled the obesity epidemic. And I think it's very important that we match the right diet to us. In terms of the low carbohydrate, what we promote in the clinic is more of a moderate carbohydrate intake, so maybe 30 to 40% of our diet coming from starches and sugars, and that can not only help us to lose weight, but to decrease some of the insulin resistance, which causes a lot of the metabolic problems we get with body weight, and also help to control diabetes better too.
Awesome. And I'm assuming those grains are more of the whole grains, the fiber-rich type of that?
Yeah, so doing that.
Okay, so we're gonna switch gears for a little bit. So Lori came back with a great question, and she asks, how do you help obese patients who've not had weight loss surgery? Maybe they don't want to go that route, or they just haven't had it yet.
Yeah, I think we see a lot of patients who aren't interested in weight loss surgery, or maybe don't qualify for weight loss surgery because their weight isn't where it needs to be, or they may have other health conditions. What we do is we go through with them how they've gotten to this point, identify medical issues, make sure there's nothing that we're missing from a hormonal perspective or a medication perspective, something they may be taking which is contributing to their weight gain or holding them back from losing weight. We identify some patterns in their eating, what things that they're doing that way in physical activity, and we work on helping them to structure a plan. For a lot of my patients, it's not necessarily a knowledge gap. A lot of my patients know that they need to change some things, but they're not quite sure what to change or how to change that, and what we can provide is the right kind of information, structure, and accountability, but also the tools to make that more effective.
Gotcha. So if you're, if people are watching this, we have kind of a varying age brackets. If somebody has a family, what are some tips that you have for maybe parents that want to get their kids active so that they don't have to worry about weight later on?
Yeah, and I think making sure that you promote activity and healthy eating is something which is done consistently and not something that's done for maybe 30 days at the beginning of the new year, or that exercise is something that we do consistently as part of a healthy lifestyle. And I think that's something that we struggle with because we're all so busy in our jobs and trying to make sure that we have the right kind of lifestyle for our families, that a lot of times nutrition, planning, activity, and planning is not going to happen. I think the key is knowing that because of our schedules and our environment, this is not a passive process. Unless we make time and plan for these things to happen, it's not going to happen. And our environment is such that we default to not having to move much, or we default to picking up higher calorie foods on the way home, or something that's marketed as healthy, which may paradoxically be worse for us.
Yeah, picking up on the way home. I know that happens often. So we have about 10 minutes left in our chat. We've got some more questions coming in. Thank you. Keep them coming right now. We've got one here from Patty, and I'm sure this comes up in your clinic. She says, I hate to count calories, but is that the only way to monitor your food intake?
I think a lot of my patients find it very tedious to count their calories, but I think I look at it in terms of education and empowerment. A lot of times when we look at dietary plans, you may get a list of things which you cannot have. And these are bad foods for me. And we really promote the idea that there's no such thing as a bad food. And we use a lot of analogies with regards to finances to help people understand that this is something that they can moderate. That if you know that you're going to a birthday party and that there will be cake, and you want the cake because you know it's a good cake, it's how do you modify what else you're doing? Because there's always going to be a birthday, a Super Bowl party, something like that, where you
don't want to miss out.
Exactly, and food is part of our social interaction with a lot of people. Making sure that you know what's in something can empower you to make that choice rather than being afraid of it or avoiding it. So in terms of counting calories, that's one way of taking control of a situation. You might want to take stock of what you eat in a day and identify a few things to change from that. And so there are other ways in which you can modify your calorie intake other than just by counting every calorie that goes in.
Gotcha.
But it can be very helpful.
Yeah, really good question, Patty. So we've got one from Valerie, and we've got one from Adrian. We're shuffling around. We've got so many questions coming in. So Adrian, he says, I hear people talking about good fats and bad fats. You've got avocados, almonds, unrefined sugar, coconut oil. Are there really good fats and bad fats?
I think there are a spectrum of fats in terms of how they help us, how they can affect our cardiovascular system, the cholesterol, other things in our blood.
Okay.
And there are studies that really look at, for example, fish oil, or people who come from areas where their diets are very rich in seafood, which may be a good kind of fat, versus coconut oil, avocado, very popular fats, particularly if you're on social media, right?
Yeah.
And I think what we need to do is understand that if weight loss primarily is due to an energy imbalance where we're consuming more calories, there may be good fats from a cardiovascular perspective or other perspective, but every gram of fat, whether it's good or bad, still contains 9 calories versus 3.5 for protein or carbohydrates. So a lot of times I have patients who may start accessorizing their diets with good fats with the hope that that's going to help them to lose weight. But simply adding calories to your diet may not help you to regain control of that energy imbalance that's promoting the weight.
That's the enjoy the peanut butter instead of the chocolate cake, it sounds like.
And sometimes it's about a trade-off, about, well, what am I going to do, but making sure that you are making the right choices within the calorie intake goal or your budget, if we use that financial analogy.
Gosh, that's important. So one from Valerie, and this is an interesting question. I think this could be part of it. Like, how do you motivate people to lose weight? And does your program, your clinic, do you offer any sort of emotional support or therapies? How does that play a role?
I think as part of the program, I think most of us have identified that it's not necessarily a knowledge deficit. It's about helping people to overcome some barriers that they may be having and identifying what emotional stressors they're going through and helping them through that. We do the best we can to work with people to identify services within the organization which can be supportive, or within the community to make sure we help to address the emotional barriers that may be there, whether it's depression, anxiety, past traumas, or for some patients disordered eating, and that's something which can be a problem too.
That definitely can be a problem. So we're running close. We got about 5 minutes left, but we're a ton of questions here. This one's from Mary, and this is another one. This kind of touches on what I asked you. And she said, aside from being empty calories, are there any other ways that alcohol hinders somebody's weight loss efforts?
I think aside from the empty calories, what we do while we're drinking can sometimes undermine us. You can imagine the typical Dallas social scene. The weather's nicer than it is today. We're out on a patio having a frozen margarita, and then the queso, the chips, other things happen. And I think alcohol consumption can make us less aware of what we're doing. And if we're in a social setting where that's happening, it can allow us to consume more than we might and maybe not pay attention to the signals that tell us that we're full or we need to stop eating.
Right. I think that the patio comment was pretty accurate to a lot of people in the area. So one thing about, obesity in general, can obesity really shorten somebody's life expectancy?
I think if you look at the data, obesity is associated with a lot of health conditions which really affect people's longevity, but also their quality of life. So aside from the diabetes and the complications that go with that, including the eye issues, the kidneys, the nerve problems, it's the cardiovascular issues. But also there are a lot of cancers which are linked to excess body weight, which can be a problem too, including colon, breast, and other gynecologic issues. So there are a lot of things that go along with obesity aside from the weight, which is why it's such an important health issue.
Gotcha. All right, so we have some people that are just now logging in, and one of them, Natalia, she asked, she's asked for your input on taking weight loss pills. Do you think they work, or is it just a quick fix? And we did address that earlier, but it seems like a good question to readdress.
Yeah, I think so many people want there to be medications which can help them take control of their weight. I wish there were a magic pill that could fire up our metabolism or help to melt fat away, but those really don't exist in practicality. And what most weight loss medications do is help us to modify our interaction with food, to decrease hunger, to decrease impulses and cravings. And I think they work best as part of a structured program. And I think making sure that you are using them to help change your behaviors rather than as the behavioral change itself.
All right. Good question, Natalia. Yeah, so, given that, so we're running close on time, but I'm wondering, what type of, I'm sure you see this, what type of exercise do you find is a good kind of entry to somebody that's trying to lose weight?
I think provided the joints are okay, walking is a great way to do that. I think we can all find opportunities in our day to take a few extra steps and make sure that we walk, during our lunch break or do something like that. But bearing in mind that walking has so many benefits for our cardiovascular health, our muscles, keeping our strength up, that it's a very easy thing to incorporate into our day. We're big fans of strength training to help people maintain their muscle mass, particularly when they are decreasing their calories. But finding the right thing for you in the right environment that's safe for you and enjoyable. And if you want to make a social activity out of it, that's even better too.
It seems like that gets right to that sustainability part of it.
Exactly.
That you want to have something that you'll continue doing and not just do it for 6 weeks and then stop.
Exactly.
So that gets to the last question we had, and they asked, how do I maintain my healthy lifestyle without falling off and just stopping? It sounds like that gets to the heart of, you've got to find something that you really like.
I think, there are a few aspects to that, and making sure that the way in which you get your weight off or the way in which you're planning to transition is something that you're able to do. A lot of times we get desperate and do things that we know are not sustainable, but they help us to get to our weight, making sure that we understand how many calories we may need to maintain our new body weight and helping us to live within that budget, but also making sure that we have the right support system in place and that we have the right plan. Again, our environment is such that if we just want for it to happen and don't put a plan in place, it's not going to happen and we're going to feel very frustrated and let down by ourselves. So planning is the key.
All right, planning is the key. So I'm sure we're going to get one more question in a minute, but while we have a couple minutes here, what would your kind of minute-long advice be to somebody that comes up to you and says, I've been trying, I've cut my calories, I'm exercising, I'm not losing weight, what should I do?
I would tell them that weight loss it's a journey, it's not necessarily a destination. A lot of people see it like as if it were an isolated condition or illness, like a sinus infection, where they're going to change one thing, take an antibiotic, and all of a sudden it's going to be gone. I think understanding that there are many things that go into it, our genetics, our environment, our stress, our time, our desires. Food is inherently pleasurable. And to change that around just because now I think I'm going to go on this weight loss journey, that's unreasonable for us to expect that that's going to just change and be very easy. And to know that most people struggle with maintaining a healthy body weight, and that there are structured things in place that can help us to do that, but that really planning is key. And if you are having difficulty in how to structure that for you, that there are places where you can go to get help.
All right. Well, I think that we are out of time, everybody. We've had some really great questions today and lots of them. Don't forget, this chat will be available here on Facebook, and it'll also be on our YouTube channel this afternoon, and that's youtube.com/UTSWmed. So please share this with your friends, send it to your loved ones. We want to definitely get this message out. And we also want to thank Dr. Almondoz for joining us. This was really great having you.
Great. Thanks for having me.
Awesome. Thanks a lot. Have a great day.